Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
We've had a number of presentations, and we haven't really looked at.
Yeah.
Hold on. Well, I think this is one of the.
Hold on, Doc. There we go.
This is one of the easiest things to deal with because you went past it quickly. But anyway, it's just a new virus that we don't know what it's going to do. But it has caused paralysis. But this is something that they talk about Navage and daily irrigations for people who have sinus problems. But they also are suggesting that this may reduce hospitalizations and deaths by having mild saline irrigations twice a day. I don't know any people who have done this for their sinus treatment, but it's something that may be of value to those who are interested. It's nasal irrigations are something that are helpful for people who have sinus problems. Any of you involved with nasal irrigations for your sinuses?
I've done this in the past. It's called using a neti pot. That's spelled N-E-T-I. And you just take warm water, half teaspoon of salt, and irrigate your sinuses. I do it whenever I feel some congestion, and you do get immediate relief.
Oh.
And some people have chronic sinusitis, and it's one of about the only way they survive it and can have the symptoms relieved. Well, I guess we're a fortunate group. We don't have too many people who have sinusitis. So.
Oh, if you do it, use salt without iodine.
That's hard to find these days. Most of the salt has iodine. So.
Yeah, but you can get salt without iodine, and it's less irritating. Salt with iodine, if you do that nasal rinse, will be irritating.
Mm.
What's interesting now, we have so many ways to treat COVID, and it's interesting that people are still dying from COVID every day.
Oh my gosh, yeah. Oh, Jesus.
That's an interesting article that points out that we've all known that salt is not something that is good for us people of color, but still people love salt. I mean, you know, we have advice given by many, including Darryl, of how you can use other things to make your food tasty. Still, people use a lot of salt, and of course, they're suggesting that using just 1 gram of reducing salt consumption by 1 gram would result in the saving of 4 million lives, which is amazing. But it's food for thought for those who still use salt. I don't know.
Oh my goodness.
We know that people of color, because of what happened to us in the transportation, those people who could survive actually became salt intolerant, relatively speaking. And this is attributed to one of the reasons why we have so much hypertension. But this is suggesting that cutting back on salt, just like cutting back on sugar, is something that is very healthy. How many of you still use salt?
I do.
think many people still use salt. They just don't use as much of it. Many just don't use salt in
No, I
the
gotta
food.
stop.
That
I have
they,
to
add,
stop.
they don't add salt to their food.
Right.
They use it in cooking, but they don't use it in their food, to say.
Yeah, I try to stay away from it,
Me too.
and especially shaking salt on your food.
Right.
That's what I really try to stay
Good for
away.
you. Yeah.
I salt to cook, but never add to it. I
Uh,
see Elizabeth put something up with Mrs. Dash, and I do use that sometimes.
Salt substitutes are very helpful. Of course, they do possess potassium, and so those patients with renal failure, it's maybe a double-edged sword.
Yeah, and I think we mentioned before that a good salt substitute is lemon. It gives flavor without the sodium. And if you want more flavor, you can zest the lemon.
Okay, thank you.
This is an article that is kind of frightening,
Yeah.
but it's pretty true, and it's particularly problematic for. But the thing that was surprising to me is, stop right here for a minute, is that mental health conditions were the top underlying cause, which was surprising to me. The other figures we're aware of, but the fact that the postpartum psychosis and other things are responsible for so many deaths was surprising to me. Of course, the fact that Black women and Native American women are more likely to die than others is well known. But the fact that a lot of it is related to postpartum psychosis and other mental health issues, which result in suicide or overdose and those kinds of things, is something that we haven't paid much attention to. They point out these occur within a week after delivery. And one of the problems is that the degree to which it affects the African American population is pretty well known. The extent to which it affects the Native American population is not as well known. But it's an issue that is something that is frightening, because the Native Americans is their country, but they have been treated so poorly that people don't even recognize how their health has been completely neglected. In addition to stealing their land and killing them, we don't even take care of them. And then this talks about the American Indian and Alaskan Native, who are ignored for the most part. To say that 90% of them are preventable is a serious allegation that we should take very seriously, and recognize that here in the United States we have some of the worst maternal mortality rates in the world.
Oh my gosh. Ooh.
And to think that we have a country that spends so much money on healthcare, but still
Yeah. Oh
fail.
my God.
Yeah.
Can't believe this.
Yes, and it's still going on. And of course, one of the problems is that it's important that you get taken care of, not when you're ready to deliver, but many months before you deliver. So as soon as you get pregnant, it's wise to start having obstetrical care, so that your baby's healthy and so are you.
Yeah.
But this calls attention to one of our biggest problems. And of course, the District of Columbia is well known to had made efforts to try to change this, but we still are lagging far behind.
That's sad. Oh my gosh.
We're talking about deaths that are avoidable. They're talking again also about sudden cardiac
Ooh.
deaths in young people is avoidable.
Oh,
This means that if people had simple tests like EKGs and everybody who has a history of heart disease, that you could make the diagnosis early and prevent a lot of these young people dying from sudden death.
oh.
This is a condition where the heart muscles thicken, and this is why many of the athletes played basketball and other sports dropped dead on the court because they had this and nobody knew it. And so that's why most athletes now, they have a EKG and other things, to ultrasounds and other things to find out whether or not they have hypertrophic cardiomyopathy. EKG is very helpful in making the diagnosis. And once the diagnosis is made, then you're given medical care. And also advised to perhaps some cases have an implantable defibrillator. Anyway, this is important for your
I'm hearing some static.
Yeah, right. So if you'd go on mute. So this is why it's important for you children and grandchildren to be tested before they decide to become athletes. And whether or not, if there's any heart disease in the family, it's a good idea for them to have EKGs to make the diagnosis.
Dr. Callender, I had a neighbor that had that condition. It's Marfan.
Now,
Is that-
Marfan is different.
Right.
Marfan is a condition which you have long limbs and you have cardiac problems. You have many, but yeah, Marfan is a special condition, which is
They
separate.
never knew he had it till he was 19
Oh,
in college. And they said you should have known because of the way his fingers and hands look.
That's correct. Yeah, right.
Mhm.
But he didn't grow up with his family. He was an adopted child.
Oh, I see.
oh,
So nobody knew the history. He passed away. He was a brilliant scholar.
oh,
Just was doing a pickup game at college
oh.
and
Really?
dropped dead.
Mm,
Wow. Yeah.
sad.
Well, it's good to know about it. So make sure your children and grandchildren get EKGs to find out whether they have this lethal condition,
Mm.
which is treatable. This is another article that talks about the fact that they're finding the poliovirus in areas that are not supposed to find it because polio is thought was to be eliminated. And so this presumes that everybody's been vaccinated. This, of course, is something that is preventable. And so wherever we find it in the water, it needs to have people tested to make sure that they've had the virus, have been vaccinated. If not, they need to be vaccinated.
Dr. Callender, quick question. When I was in elementary school, that was probably 50s. I think I got my polio vaccine on a sugar cube. Was that done then? Was that?
Yeah,
Okay.
it was oral.
Oral.
And it's supposed to be a long-lasting life vaccine. So if you've been vaccinated, it's not an issue, but if you haven't been vaccinated, it's an issue.
I remember that years ago.
90%. 90% is still not 100%. So
Mhm,
there are people who are vulnerable.
mhm.
It's interesting that we presume that everybody's vaccinated, but that is not actually the case. 90% is still not 100%. And you can see in some areas the vaccine for measles is as low as 60%. It's awful. And it's related to the vaccine resistance that we all know about that was emphasized during the coronavirus situation. People refuse to be vaccinated for reasons that are good. I mean, some had good reasons, some had just misinformation. There's another interesting article about the fact that we actually performed the 1 millionth transplant September the 9th, I think it was. And
They were all golfing and everything with each other.
we did the first transplant in 1954. And so now, 8 years later, we performed our 1 millionth transplant. So everybody else will go on mute if you want help. Would you go on mute, please?
Yeah, Maya, can you go on mute?
Well, anyway, this is what is interesting is that in spite of all of the advances, we still have mistakes, and this points out mistakes. When you think about the fact that we've done 1 million transplants, the number of mistakes are very infrequent and are addressed. But that doesn't help you if you died because you got an infection that was transmitted by a person who donated it, or you got cancer from a donor with cancer. So they're still having a lot of issues trying to make the transplant program as good as it can be. So it's not perfect. It has failures, but it's been doing an incredible job. I think this is the first country in the world to have performed 1 billion transplants.
Oh, wow.
Any
Mm.
comments or questions? Many things are happening nowadays. Many things we're using different ways of preservation of organs.
Yeah,
We're using,
and I went to the one that's up at Glover Park.
So- we're using warmed organs rather than cold organs, and we're also being able to improve organs with the warm preservation that we couldn't improve with the cold preservation. So we're making a lot of steps, but still, remember, we had made a comment earlier that that the system was called demonstrably inequitable, particularly as it relates to the African American. So this is something that we have to keep in mind. It's something we're working on. It's not perfect yet, but it still has accomplished very much. This is a nice story about a
Yeah.
man who lost all that weight to be eligible to donate liver to his dad. You can see how big he was there. 478 pounds when he graduated high school. And he couldn't be a donor. So he made an appointment and had a bariatric surgery. And as a consequence, he was able to get down to the point where he could be a donor.
Oh, that's nice.
And as you know, the liver, you can take part of the liver out successfully,
Mhm.
and the liver will regrow itself. So as a consequence of the bariatric surgery, he was able to donate a liver to his,
Oh, that's nice.
yeah.
Very nice.
So it's quite a miracle to see this
It is.
kind of thing.
Yeah.
So, well, anyway, these are some of the good things that are happening as a
Yeah.
consequence of being able to have successful liver transplants. Of course, our role model, of course, is John Tatum, who is
Oh, yeah.
in his 29th year after having a liver transplant. So, and I don't know, is Kevin on today? I know Kevin is being worked.
He's not here today.
He's been worked up in October. We're going to have a presentation by a doctor who's a liver transplant surgeon, who will be talking about how you can get a liver transplant. Now, this is a subject that we don't talk enough about. Oral health.
Mm.
Unhealthy gums not only produce infection, but they also increase the likelihood of dementia.
Oh my God.
This is something that we haven't talked about before. We know that it causes infection and leads to heart disease and other things,
Ooh.
but there hadn't been data that identifies it as an actual cause of dementia. And what this article is saying is that it's data suggesting that it is related to dementia. Of course, we really aren't positive about what causes the Alzheimer's dementia, but there's so many contributing causes to dementia. Now we add to this parental disease. Question is, how often do you go to your dentist? And how often do you do total appropriate dental care? How many people floss? How many people do not floss? How many people have unchecked parental disease? We still don't know everything there is to know about Alzheimer's, but in our ignorance, we try to do everything we can to try and prevent it from occurring. The mouth is one area that prior to this study hadn't been looked at as a possible cause for Alzheimer's. Now, this is an article that was kind of scary a bit, because it said that if you're over 65 and you get COVID, the risk of Alzheimer's was markedly increased, particularly in women. Since COVID has been so prevalent and around so much, this has been a cause of concern for people who are older than 65. And so all this says is that you have an increased risk for it. It doesn't say that we know for sure, but we have identified that in people over 65 who had no prior diagnosis after they had the COVID, the risk was doubled. This is may or may not be, it's association. I think this statement is very important. Association, not causation. It doesn't mean you're going to get it, but it just means that there's an association. So, but anyway, it's food for thought. Of course, the only thing we can do is try to do what we can to prevent getting it. If you get it, to get it treated as early as possible. I thought this was a good thing to include, even though it's not available yet. because the FDA has not approved it. But this is the first study of its type that demonstrates that this drug can not only treat but prevent Alzheimer's disease. Now, this is the first drug that has been shown to do anything for Alzheimer's disease. And so this is an oral agent, and it is working its way through the phase 1, phase 2. It's in phase 2 in patients with early Alzheimer's disease. And so it is likely that within a couple of years, a year or so, you'll have it available. What has to happen, of course, has to go through phase 3. And after that, it will be likely FDA approved. So this is good news. We haven't had any drug that was effective at treating or delaying the onset of Alzheimer's disease before this. So this is good news. And also suggests that maybe we were right about what was causing Alzheimer's disease, because it looks like this drug clears the amyloid bodies, and this then results in reducing the brain edema and also in demonstrated cognitive gains, as well as proved by memory tests and other things. So this is something that finally having some results of all the research that's being done on Alzheimer's. And so it looks like within the next year or so, we'll have perhaps that drug available to make a difference. One of the things
So Dr. Callender, I have a question. On this particular article, I'm not able to read too fast on this, but want to make sure, like, you get Alzheimer's and they would then give you this drug. Does that slow it down?
Yes.
Or, okay, so it would slow down the progression of it after you get it. But also, if I'm reading this thing right, you could potentially take it ahead of time if you are in one of the at-risk categories, and it might hold off the onset. Am I following this right?
That's correct. And if you're not on our list to receive these articles, let Mr. Buchanan know, and you can get this article as well. But yes,
All right.
your conclusions are absolutely correct. And this is the first
Okay.
drug that has been done to show either of those things, that there's been improvement or that it could prevent it. So yes, this is remarkable breakthrough that has gotten through to phase 2, which means that it's pretty close to the point where it will be FDA approved, probably in a year or so.
All right, thanks.
But your conclusions were absolutely correct. Now, this is any other questions on that? Otherwise, this is something else that is brand new. Because of the mental health issues becoming so much to the forefront, the Preventive Services Task Force, for the first time, requested the adults between 19 and 64 be screened for anxiety. And what this is saying is that anxiety and mental health issues have become such a problem that we need to have screening, and those people who are screened, who have these problems, should get treatment for it. And this is something that has not been done before. Of course, people with great anxiety are candidates for suicide, and depression. And so this is the first time that it's gotten to the point where we've got sufficient evidence that those people under 65 need to be screened for anxiety. It's interesting, they couldn't find evidence that those over 65 needed it, but certainly those under 65. Any thoughts or comments about this remarkable article? We had talked before about the fact that since COVID, mental health issues have escalated. And this is another example that they found that 25% of the population is suffering from serious anxiety. And we recognize that the pandemic would cause an epidemic of mental health issues, but this is one of the first evidences of it that it's really here. And so some of the comments that President Biden made relative to getting our mental health system in better shape become even more important. This is an article that talks about why the flu vaccine is more important this year than ever before. Of course, this is saying it at a time when you can do something about it. We know that the flu has been resulting in deaths every year. This was decreased because of the pandemic. But there was a concern that while last year the flu deaths decreased, this year is that the fear is that there will be a rebound. And the flu vaccination, it's interesting. When should you take the flu shot? And I know that my doctor recommended that you wait until October because the flu shot works for about 6 months. And the earlier you take it, the sooner it'll expire. So that he recommended that you take the flu shot in October rather than in September. But the flu actually begins, the flu season begins in November and lasts until probably March, April. And so it's important to get a flu shot. I remember, I think Darryl had pointed out that there were so many deaths from flu before all of this began. And we sometimes didn't realize that the flu was killing so many people, but it has always been. And so it's really important now that we've got the double whammy here, COVID and the flu, that you get your flu shot.
Dr. Callender, do you think people have been persuaded to get the flu shot more since we've had COVID? Because before COVID, there were a lot of people that were apprehensive or didn't want to take the flu shot because it was going around that if you took the flu shot, you would get the flu.
It's going to be interesting to see. I have no idea, although that I think the fact that 70%, 90% of annual flu deaths are in people over 65 and in people who are not vaccinated is something that people should take very seriously, especially in the more vulnerable group. But I don't know whether they're going to be wise enough to recognize that it's even more important now than ever before. So I don't know the answer to your question. Time will have to tell. I'm hoping that this will be the case. But as you know, there are some people who really hate vaccinations and they will refuse. They'd rather die than be vaccinated. So I don't know the answer to your question.
Dr. Callender,
Yes.
do you recommend seniors to get the monkeypox?
No, unless you are having sex with men who have sex with men.
Mm-hmm.
I would recommend against it. If you're having sex with men who have sex with men, yes. Or if you're a man who has sex with men, yes. But other than that, I would say no.
I asked that because a doctor said that he was elderly and his immune system was compromised, and he got it.
Well, I think if your immune system is compromised, I think that's a reason to think about it, particularly if you are exposed to people who have, for example, if you're a healthcare provider and you work with people who have the disease, because disease is transmitted by touching. And so if you work with people who have the disease as your health provider, then that's another story. But if you're not a health provider and you don't, you're not involved with people who have sex with men, and you don't have, you're not exposed to the lesions of monkeypox, then I would advise against it.
Patient came here and said that he had monkeypox.
Who did?
And a patient that getting ready to draw blood on, and I walked out the room.
Yeah, well, I would think that if you have if you're on immunosuppressive drugs and you're exposed to somebody with monkeypox, then that's a reason to take the vaccine. Yeah.
In one of the articles we had last week, the deaths, there were 2 deaths related to monkeypox. The people that got it had immunosuppression, and that's how they died from it.
Right. Now, it's interesting, the monkeypox vaccine required 2 shots, 28 weeks after the other. Yeah.
Dr. Callender, can I back up to the flu shot for a minute?
Okay.
When you're counting flu deaths, deaths because of flu, are they counting the people who did take the vaccine along with those who did?
Yes. Yeah, because most people who die from the flu are people who are in the over 65 age group, or people who didn't get vaccinated. So the death rate is higher in those people who didn't get vaccinated, or people who, or people who are immunosuppressed. Yeah. Does that answer your question or not? Maybe I didn't understand your question.
Yeah, it wasn't about immunosuppressant. It was just about the flu deaths and how many died because they didn't take it.
Most of the deaths were in those people who did not take the flu vaccine. Any other questions about the vaccines? Because we're in the fall season, and that's just the season where vaccines play a major role in preserving your health. Pneumonia vaccine as well. So this is an interesting article that talks about how daily breath training can work as well as medicine to reduce high blood pressure. This is an article that looks at a population which I'm not sure, he didn't identify the ethnicity of the population, but he found that doing 30 breaths per day for 6 weeks lowered the blood pressure by about 9 millimeters. And this is what would be expected with conventional aerobic exercise, such as walking, running, or cycling. So, so exercise, once again, is something that is healthy, although if you do those things and your blood pressure is not normalized, then you need to do whatever it takes to get your blood pressure normalized. One of the problems we're having is Joyce and many others who do the screening find is that many of the patients who have high blood pressure are people who know they have high blood pressure and aren't taking their medications properly. And so it's also important that you take your blood pressure medicine as it's ordered, so that you actually have a normal blood pressure. Because if you still have an abnormal blood pressure and you're taking blood pressure medicine, then you're not taking enough blood pressure medicine. And so this is an important aspect of it, that we should be taking our blood pressure medicine if you have it, and you should be exercising as well. Those things together, along with the breathing, would be effective in good health. Now, those who do meditation, do yoga, and all of those things, will do the breathing anyway. But those who don't wouldn't recognize the advantage. So it's something that works.
Dr. Callender, woodwind players also use, and vocalists use diaphragmatic breathing as well. So music helps.
Yeah, yeah. Okay. Now this is in a way a positive take on the COVID variants. One thing that has made this epidemic so long lasting is the fact that we keep getting new variants. What is noticed recently is that the variants have decreased in their frequency. And the stagnation of the variants is a good sign that maybe we may be approaching the end of the pandemic. I know that the president said the pandemic is over, but in spite of what he said, the number of people who get new infection, the number of people who die is still very high. And so, but the fact that the variants have plateaued over the last 5 weeks is gives us hope that maybe he's right, that the pandemic is on its way out.
Dr. Callender, are there still parts in
Can't
this?
always be wrong. Go ahead, Mr. Jordan. I'm sorry.
All right. Are there still parts in this world where the pandemic is not over? And, you know, we're getting a lot of our inoculations going on. That's great. But in other countries, they still have some pretty stiff regulations and restrictions. That's still true because the pandemic is still very real in other places, not the US, correct?
Excellent point. Excellent point. And one of the concerns that is brought up by this pandemic is the global inequities that exist in other parts of the world, and the fact that it is kind of unethical in the way we look at it, in the sense that we have developed countries that have access to the vaccine and developing countries that don't have access to it. And we should not rest until all of the countries have access to the vaccine, which, as you point out, is not the case. And so
yeah,
until that happens, I think we can't sleep well at night, understanding that there are developing countries that still don't have access to the vaccine like we do.
Yeah. All right. Thank you.
Now, this is an article I thought was good because so many people have questions about the Omicron boosters and who's eligible first. And all those over 18, if they've already received a primary vaccine or a booster at least 2 months before, and that's the issue you have to keep in mind, that ideally, you know, if you at the end of 6 months, and many believe that the virus isn't as protective as it was at 1 to 2 months. But at the end of 6 months, it's less protective. And so if you received a primary vaccine or booster at least 2 months before, then you're eligible for the new bivalent boosters that protect against the BA.4 and BA.5 strains, which is affecting 90% of the American population. Now, children under 12 are not approved. And that's because the tests in those people has not been done. And so now, of course, those who are under five years again are not eligible as well. But saying under 12 says it all. But it is hoped that by October that the FDA authorization will occur. How do they differ from the previous shots? Those of us who've gotten the boosters already will know that the side effects are the same, perhaps a little less, but the fact that it is addressing the BA.4 and 0.5 makes your immune system better able to address the new variants, which the other vaccine did not. Are there any new risks? And the answer is no, they didn't see any new risks. Do I need new shots if I've already had past boosters or even had COVID? Answer is yes, because the bivalent Omicron shot gives you that broader immunity. There's no question if you haven't had been vaccinated at all, then of course you need to be the primary vaccine. But if you had the primary vaccine, then the booster. How long should I wait from the time of my last shot before getting a new booster? And I think it's pretty clear that between 4 to 6 months is a good time to get a booster, although if you're 3 months, it's okay too. Then this question, what if I've recently had COVID? There's no room. And so, although again, you might want to wait 8 weeks, but we don't really know. If I never got the original, do I need to get those shots first? And the answer, as we mentioned before, the primary vaccine is necessary. This is the booster. But if you're not getting the primary, then it's not a booster. You need to get the primary first before you get the booster. Do the entirely replace the other boosters? And the answer is yes. These are the boosters that are appropriate. Now, this is interesting. What if I receive the DNA vaccine? Should I still get an RNA booster? The answer is you can mix and match. So if you got the DNA, you can get the RNA as well. So, and how effective are the new boosters? This is interesting because they don't have the effectiveness data yet, but they are believed to offer greater protection. And this is one of the questions that many people had, was that have they done studies to prove how effective this bivalent vaccines have? And the answer is they haven't completed those studies. But they do know that we're talking about it being a booster. So it's boosting the already good effects of the vaccines. How long will the booster's protection last? That's a question that we don't know the answer to. And it's got, some are thinking that it will last for a year. Some think are still thinking it's going to last 6 months. Time will tell. They have to do more studies and share the results before we actually know the answer. Now, here's the other question that people ask all the time. Is it okay to get a flu shot and a COVID booster at the same time? And the answer is yes, but my advice to you is to get your flu shot no earlier than October. But other than that, you can get the COVID and the flu shot at the same time if you like. I just think getting it, the flu shot early rather than later is not always a good case for people who have weakened immune systems or have chronic health conditions. Now, here's one of the last questions. Will a new booster mean I can stop wearing a mask, social distancing, and avoiding crowded spaces and taking other precautions to avoid COVID? And the answer with exclamation point is no. That it's common sense and wisdom is still expected. And so while you got a new booster, keep in mind that with the vaccine, it doesn't totally eliminate you getting an infection. It eliminates the likelihood of you requiring hospitalization or death, but it doesn't prevent you from getting an infection. So it's wise to use common sense and use the mask and distancing and avoiding avoiding infection to the extent you can. And you look at this now, 67,000 new cases and nearly 320 deaths each day. So while the president means well, it's hard to say that the pandemic is over. Any other questions or comments? Anything they didn't cover in the Q&A? Or any questions you have? Because these are questions that most people are asking about the new booster. And we included this because I thought it would help answer many of the questions you might have. However, there's no questions, we can move on. And then, of course, just about everybody's recommending the updated boosters for those who are over 12. Now, the Moderna and other, I guess the Moderna, I believe, has been FDA approved now. Yeah. Now that it's all this has been FDA approved, this is what is necessary to help us to make it through the fall season. Well, the president, maybe to the president, he feels it's over. And there are a lot of different opinions about it. Some people say it's now endemic, and so it's not a pandemic. I think Mr. Jordan's point about the fact that it's over, maybe over for us, but it's not over for the rest of the world. It's something to keep in mind. And we certainly are better off than we were 2.5 years ago. Yeah, but everybody else kind of would disagree with Biden's comments. Well, some would articulate that it's endemic now in the United States and not pandemic. But the fact that there's so many people dying every day suggests that we're in the middle of a battle. That's where I would look at it. Well, I don't think you're gonna find too many people that will agree with the president, although and they brought up that point that Mr. Jordan brought up that people that other places don't have the virus, they're dying. So don't tell me that the pandemic is over. So let's wait and see. I think the president is maybe the Lone Ranger on this, but there are others who probably feel that it's endemic. It's endemic now, and that's technical, calling it an endemic in the United States rather than pandemic. But anyway, and if you haven't received these articles, you should get them. They're very, because even when we have presentations, we still pass around these articles, which we have all looked at and felt that they're good for the group to look at and evaluate. And here's the issue that the president may be talking about the United States, but the rest of the world still has a problem. And if it's a pandemic anywhere, it's a pandemic everywhere, is one way of looking at it, as has been already stated. And I think this is important, that debating that is not the issue. Focus on eliminating the number of deaths and hospitalization that occurs as a consequence. So, and they say, yes, it's a global issue. That's right. Yeah. And I think Joe should think a lot more, speak less. Means well, but he lost ground on this one.
Yeah, especially when you consider he got it, the rebound, his wife got a rebound. And then looking at the Queen's funeral from earlier this week, all those people came from all over the world, and then they got to go home. And it's just.
Did you see a mask anywhere?
No.
No.
I didn't see a mask anywhere.
No. No.
And so, so this is where my mind is, I saw him on 60 Minutes. I'm thinking, what? And then, watching the funeral on Monday and everybody's there. And I didn't see any masks.
Yeah, it was scary to me, because your evaluation is quite on target.
Mm-hmm.
Also, Dr. Callender, when I was in Israel, I didn't see a single person wearing a mask. Only the hospitals, everybody has to wear a mask there.
Yeah.
I was shocked.
Israel is a developed country, so.
But
yeah.
Egypt also the same way. Nobody was wearing a mask.
Really?
Nobody. Yeah.
Hmm.
But I was wearing.
The Lone Ranger. Okay. Right. Well, this is a new virus, and we all know that the big one is coming, according to the scripture. And the ultimate plague is coming. But
Yeah.
anyway, this one is the extent to which this will become a problem is not known yet. There's just an outbreak in the state, and whether that's going to be isolated or not, we'll have to wait and see. So right now, it's not yet a concern, but it's something for us to at least be aware of.
Right. Absolutely.
One thing we can do though is to take the vaccination shots that we can take to deal with viruses that we know of that are already here.
Yes.
By the way, Mr. Jordan, have you been here before?
Yeah, this is my second visit.
Oh, wonderful. So good to have you.
Yeah. No, this is good stuff. I got a little bit lost last week. I ended up looking at the interview that Darryl had with you, and I thought it was pretty interesting about thinking, where's everybody else? And so I was in the wrong place, and then I had to leave anyway because I had,
Oh, really?
I had an appointment, but it was a good interview. So, good interview.
Yeah.
Yeah.
Okay, is this the last one, Buchanan?
Yes.
Dr. Callender, he's our
Yes.
first cousin. Darryl
Yes.
and Jordan. He's our first cousin.
Oh, how about that?
Yes.
How about that?
Family.
Wow. Wonderful.
Yeah.
And as you can tell, he's a really smart guy.
Runs in the family, huh?
I'm
Except
trying to
for
keep
me.
up with those two. I'm trying to keep up with those two. So
Yeah, well, Darryl's tough to keep up with.
Mr. Jordan, are you on the email list? Are you getting the emails?
yes, I am.
Okay, good.
And so I've been getting a couple weeks. That's good. See, I just got a little lost last week. I'm thinking, okay, well, I'll just jump back in this week.
Okay. All right, any other questions about any of the articles? Okay, we'll take that off, John. Any announcements or John Tatum, you want to give us an update for the group about how you're doing? Tatum?